We now discuss blood deficiency under diagnosis according to 8 principles. When there is too little blood in the body, the tissues will lack nutrition and moisture. This will manifest with dry, pale skin. This will be most evident in the face, which will have a sallow complexion, but there will also be dry skin in general on the body. The hair will also be dry and can shed due to the roots lacking nourishment. Pallor and dryness will be seen on the tongue and lips, and the tongue will also be thin. When the muscles in the limbs lack nourishment, numbness, tingling, and muscle cramps can result. Women who are blood deficient will often have spars or even no menstrual bleeding. Blood deficiency can also be a cause of infertility. Blood nourishes the skin. Blood deficiency will often manifest with dizziness, especially when the person gets up after sitting or lying down. The lack of nourishment to the brain can cause a person's memory to be poor. A blood deficient pulse is usually choppy or fine. There are further symptoms and signs that are specific to heart blood deficiency and liver blood deficiency, respectively. In practice, both of these organs are almost always affected in a blood deficiency condition. This means that there will nearly always be symptoms and signs of these imbalances when there is a general blood deficiency. Liver blood nourishes the eyes. Liver blood deficiency, therefore, typically manifests with spots in the visual field, blurred vision, and poor night vision. Liver blood also nourishes tendons and nails. Brittle, weak nails that fray or nails that are dry and ridged are therefore always a sign of liver blood deficiency. There will often be poor sleep because the hun is not being anchored by liver blood. When the hun is not anchored, there can be dream-disturbed sleep. In extreme cases, the person can have the feeling that they leave their body at night. The close relationship between the hun and liver can also be observed in someone with liver blood deficiency who has become depressed and has no vision in life because the hun is not being nourished. Heart blood deficiency can be seen in symptoms such as palpitations. This is because the muscles of the heart lack sufficient nourishment to be able to carry out their functioning optimally. At the same time, the Shen lacks nourishment and is not strong enough to control the physical aspects of the heart. The emperor is losing control of the kingdom. When the Shen is not anchored and nourished by heart blood, there will be symptoms such as insomnia and a slight feeling of unease or anxiety. Blood deficiency can arise when not enough blood is being produced. This will be due to the person not consuming enough food that nourishes blood or the organs that produce blood being Qi deficient. Blood deficiency can also arise when the body loses blood through hemorrhaging. This is typically seen after childbirth, surgery, physical trauma, and heavy menstrual bleeding. Furthermore, prolonged physical or mental emotional stress consumes and thereby weakens blood. Symptoms and signs are dizziness, palpitations, pale and sallow complexion, dry skin, dry and pale lips, insomnia, frayed, brittle, or rigid fingernails, scanty or absent menstrual bleeding, infertility, numbness and tingling, muscle cramps, poor memory, spots in the visual field, blurry vision, depression, mild anxiety or unease, pale, thin, and dry tongue, choppy or fine pulse. Key symptoms: pale and sallow complexion, dry skin, scanty menstruation, choppy or fine pulse. Treatment principle: nourish blood. Choose from bladder 17, bladder 20, bladder 21, bladder 23, spleen 3, spleen 6, stomach 36, kidney 3, RAN 4, RAN 6, and RAN 12. If there is liver blood deficiency, add liver 3, liver 8, and bladder 18. If there is heart blood deficiency, add heart 7 and bladder 15. Needling technique is tonifying. Moxa recommended especially on stomach 36, spleen 6, and bladder 17. Bladder 17 nourishes blood. Bladder 20, bladder 21, spleen 3, spleen 6, stomach 36, and REN 12 tonify spleen chi, which is needed to produce ku chi. Bladder 23, REN 4, REN 6, and kidney 3 nourish Jing and tonify Yuan Qi. Liver 3, liver 8, and bladder 18 nourish liver blood. Heart 7 and bladder 15 nourish heart blood. It is important that a person who is blood deficient eats a diet that is rich in food that nourishes blood. It will be good for them to eat foods that are rich in blood, such as red meat, bone marrow, and blood sausages. Eating organic liver will be particularly good. Green leafy vegetables will also be beneficial due to their high iron content. Other foods that nourish blood are beetroot, eggs, seaweed, watercress, avocado, dates, and beans, particularly aduki beans, black beans, and kidney beans. A person who is blood deficient should avoid sugar, stimulants such as coffee, and too much alcohol. Nettle tea will be good for them. As well as being rich in blood-nourishing foods, their diet should strengthen their spleen qi, as the spleen must transform the ingested food into ku qi, the raw material of blood. This means they should consume warm, prepared food that is not cold in its energy and that does not create dampness. Thank you for your attention.